So now we are going to discuss about navicular bone. So according to the name, you can understand this navicular, it's like boat shape, and it is situated on the medial side of the foot, especially in the front of head of talus, right? And it's behind the three cuneiform bones, namely the medial cuneiform, intermediate cuneiform, and the lateral cuneiform. So this is actually between the talus head and also three cuneiform bones, right? So how to determine whether it's of right side or left side? Let us understand side determination points. So coming to the anterior surface, it's convex and divided into three facets. So why it is divided into three facets? To articulate with three heads of cuneiform, like medial cuneiform, intermediate cuneiform, lateral cuneiform. So three heads, 1 2 3, three heads on the anterior surface, right? And the posterior surface is concave and oval for articulation with the head of talus. So only one head on posterior side. Next, coming to dorsal surface. Dorsal surface or superior surface. This is the dorsal or superior surface, right? This one, it's broad, convex from side to side, and it is rough for attachment of ligaments, right? Plantar surface is nothing but on the back side, that is on your sole side, right, where you place your foot on your slipper, that side. Okay, so plantar surface is small and it's slightly concave from side to side. It's rough and non-articular. Of course, it's non-articular because there is no more bone to articulate on the sole side or plantar side. So this is the dorsal side, which is shown in the diagram. The plantar side is not shown here. Now coming to medial surface. Of course, this is the medial surface, right? It is blunt and prominent tuberosity. So this is the main thing. This is a trick to find out whether it's of the given navicular bone is of right side or left side. So now you can see the medial side is having a tuberosity here, right? And this is of course the navicular tuberosity. It's directed downwards, and this tuberosity is separated from plantar surface by a groove. So if you see on lower side, you will find out a groove over there. Next, coming to lateral surface, it's rough, irregular, but has a facet for the cuboid bone. So it articulates with the cuboid on the lateral surface, right? So coming to the attachments, like what are attached to it, mainly to the tuberosity of navicular bone, it receives insertion of principal insertion of tibialis posterior, right? Because of course the tibia bone will be on this side, on the medial side. So tibialis posterior will come here and it's getting inserted, and also the groove below the tuberosity transmits a part of tendon of the muscle to other bones. So as I said, on the dorsals, on the plantar surface, you will have the groove. In that groove transmits mainly this tibialis posterior tendon, okay, to other bones. Next, coming to plantar surface, this one, it provides attachment to spring ligament or plantar calcaneonavicular ligament, that is between calcaneus and the navicular bone. Here at this junction you will find the actually in the true bones you will see the gap. So that is mainly covered by a spring ligament, or also called of course the plantar calcaneonavicular ligament. Next, the calcaneonavicular part of the bifurcate ligament is attached to the lateral surface, of course, and to the dorsal surface are attached to talonavicular, cunonavicular. Talo means between the talus and navicular there is a ligament, talonavicular. Cuneonavicular means between the cuneiform bones and the navicular there is a ligament, and cubonavicular, of course. So just nearby bones you can mention the ligaments. For example, talonavicular, calcaneonavicular, cubonavicular, cunonavicular. So by surrounding bones which are attached to navicular, just that names of that ligaments. Very simple. Now going to ossification. So they ossify from one primary center, and that appear mainly during third year of your life. So only primary center, no secondary center you find in the navicular bone. So only one primary center. So this is all about navicular bone, its side determination. So main point of side determination, on the medial side it has a navicular tuberosity, that's it. And coming to attachments, we saw all the ligaments. Just see the nearby bones and just give the name according to it. And ossification, only one ossification center, that only primary one, and appears in third year of life. So we are done with navicular bone. Next we'll go with cuneiform bone.